Hi, Ms. Bagwell. My name is Kate Darnell, and I'm the nurse practitioner who will be taking care of you today. I'm affiliated with Auburn University, and we're going to be doing your head-to-toe physical assessment today. How are you feeling?
Good.
Okay, good. Well, I know we already got your height and your weight, your vital signs, your BMI outside the room. Everything looked good. We also checked your visual acuity. It was 20/20 in both eyes without corrections. You'll be glad to know that's normal. I'm just going to do a quick general inspection of your appearance. You're well developed, well nourished. Your skin is soft, intact, dry, and normal for ethnicity. I'm going to go ahead and look at your head, look for any obvious lesions or deformities. Okay, we'll feel your hair. It's soft and well groomed. I'm going to go ahead and feel your scalp for any abnormalities. Tell me if you feel any tenderness. Everything feel okay?
Mm-hmm.
All right, we're going to go ahead and feel your sinuses as well. Tell me if you feel any tenderness. How's that feel?
It's all good.
All right, good. I'm going to place my hands here. I want you to open and close your mouth for me. Any pain?
Mm-mm.
All right, no clicking, so no TMJ. That's what we're looking for. All right, so I'm going to test your nostrils, patency of your nares. Go ahead and breathe in for me. Very good. Excellent. In just a moment, I'm going to grab my spoon. Okay. So just going to look inside your nose. If you go ahead and tilt your chin up, look at the ceiling for me. Excellent. So I'm looking at your turbinates, which is the tissue up inside your nose. It's pink and moist, which is normal. No septal deviation. Your nares are patent. You can breathe in on both sides. Any pain?
Nope.
Excellent. I'm going to go ahead and look at your ears now. We're going to feel the outer auricle. No lesions or deformities. Any tenderness?
Nope.
Okay. Go ahead and look inside your ear. So your ear canal is clear. No impaction, erythema. Your tympanic membrane is pearly gray, which is normal. All landmarks visualized. I'm going to check the other side. Any pain or tenderness?
Mm-mm.
Excellent. All right, tympanic membrane is pearly gray on this side as well. All landmarks visualized. A small amount of brown cerumen in your ear canal, so you just got a bit of earwax. All right, I'm going to look in your mouth real quick, so go ahead and open wide for me. Excellent. So oral mucosa is pink and moist. Dentition is normal. No cavities, no lesions. Go ahead and lift your tongue for me. I'm going to look underneath. Excellent. No erythema in the throat. Go ahead and stick out your tongue. All right, no tonsillar enlargement. Uvula's midline. All right, go ahead and close your mouth for me. Next, we're going to look at your eyes. So go ahead and cover one eye for me. All right, and then cover the other eye. Excellent. And now I'm going to shine a light in your eyes. Just stare straight at me. Very good. Now I want you to focus on this pen light with your eyes and then look at the wall behind me. Then look at the pen light. And then focus on the wall behind me. Excellent. So your pupils are equal, round, reactive to light, and accommodation, which is what we're testing with this pen light here. I'm just going to lift your eyelids. Your eyebrows, eyelids look normal. Sclera, conjunctivate, iris, all within normal limits. Your sclera are white, no conjunctivitis. All right, so I'm going to take a quick look with my ophthalmoscope here. So we're going to test your red reflex. Just going to shine this light here. All right, very good. Look on both sides. Okay, we're going to look up close. So your optic disc is visualized with sharp margins, no exudates or erythema. We'll look on the other side. All right, both sides are equal. Excellent. All right. So now we're going to test your cranial nerves. You have 12 of them, so there's going to be a little series of tests. The first one, I'm going to have you close your eyes. I'm going to hold something out for you to smell. I want you to tell me what you smell. Before we do this, do let me know, are you allergic to anything?
No.
Okay, good. Go ahead and close your eyes.
Is it peppermint?
That's good. Cranial nerve 1 is intact. Cranial nerve 2 is tested by your visual acuity test, which we already did outside the room. There's a couple of other tests we're going to do as well that test both cranial nerve 2 and 3. So one of them is going to be your extraocular motion test called the H test. I want you to follow this finger with your eyes. Don't move your head, okay? Very good. So that tests cranial nerves 3, 4, and 6. And then I'm going to do a peripheral field of vision test. So cover one eye for me. And then tell me when you see my hand coming in your field of vision.
I can see it. 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 I can see it.
Very good. We're going to do the other side.
I can see it. I can see it. I can see it. I can see it. I can see it.
All right.
I can see it. I can see it. I can see it. I can see it.
Excellent. Now we're going to test cranial nerve 5, which is your facial nerve. So just tell me when you feel me touching your face.
Feel it. Feel it. Feel it.
Very good. And then clench your jaw for me. Relax. Clench again. Awesome. I'm going to test your sensation real quick. Tell me when you feel a soft touch on your face.
Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Very good. And tell me when you feel a pinprick.
Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Excellent. All right, now we're going to test cranial nerve 7. This is always a fun one. Go ahead and smile for me. Very good. And then show me both your top and bottom teeth. All right, frown. Puff out your cheeks. Raise your eyebrows. And then squint your eyes as tight as you can. Excellent. Good job. We're going to test cranial nerve 8 next, which is your acoustic nerve.
Yes.
So I'm going to whisper something in your ear. I want you to tell me what you hear.
Warm. Cold.
All right, very good. So the next thing is I'm going to test your gag reflex because this tells us if cranial nerves 9 and 10 are working. So go ahead and stick out your tongue for me. All right, good job. Definitely intact. All right, we're going to test cranial nerve 11 by having you shrug up against my hands with your shoulders. Very good. And then I'm going to have you test cranial nerve 12 by sticking out your tongue, moving it side to side. Your voice and your articulation are normal as you're talking to me, so that tells me that cranial nerves 5, 7, 10, and 11 are all in good working order. So we're going to look at your neck next.
Okay.
I'm just going to look for obvious lesions, masses, abnormalities. Okay. I'm going to palpate your lymph nodes. So you've got your occipital, postauricular, preauricular, tonsillar, submandibular, submental, anterior cervical, and then both of your posterior cervical chains. And then I'm going to feel down on your collarbone. That is your supraclavicular nodes. And none of your nodes are palpable. That's good. That's a sign that you likely don't have an infection. So next I'm going to have you test the range of motion for your neck. Go ahead and tilt your chin down to your chest, and then up. Turn your head to one side and the other. And then tilt your ear down to one shoulder and the other side. Excellent. If you would, turn your head towards that wall. I'm going to listen for a carotid bruit. That's an abnormal blood flow in your carotid artery. Very good. And do on the other side. All right. So when I'm looking at your neck, I don't see any external jugular venous distension or blood flow backing up into these veins. If we had a reclining exam table, I'd have you lay down at 45 degrees and we'd look to see if you had any internal jugular venous distension, but we don't have that table right now, so we'll save that for another day. So I'm going to come around to the back of the table and we're going to look at your lungs now. Okay? All right. So inspecting your posterior thorax. Everything looks normal, no masses, obvious abnormalities. I'm going to feel. Tell me if you feel any tenderness or pain. Everything okay?
Mm-hmm.
All right. So I'm going to place my hands here at the 10th rib, and then go ahead and take a deep breath for me. All right. So your respiratory excursion is normal. You're expanding equally on both sides. I'm going to go ahead and put my hands on your back, and when you feel my hands, go ahead and say the words 99 for me.
99, 99, 99, 99.
Very good. That's tactile fremitus. That helps me to know the resonance of your lungs to see if there's anything inside of them that shouldn't be there. I'm going to percuss your lungs. All right, very good. All of your lung fields are resonant. That's what we want to hear. I'm just going to have a quick listen. Take some deep breaths in and out of your mouth for me. All right, very good. All of your lung fields are clear. I don't hear any adventitious sounds. So I'm going to come around and do the same thing on the front. So I'm going to palpate for any tenderness or abnormalities. Does that feel okay?
Mm-hmm.
All right, very good. Smell here. Okay, well, go ahead and say 99 for me.
99, 99, 99, 99.
Excellent. So tactile fremitus is equal both sides. I'm going to go ahead and percuss you again. All right, so all of your lung fields are resonant to percussion. That's good. Go ahead and have a listen and take some deep breaths for me. All right, very good. So I'm going to move on to your heart. I'm going to feel for your apical pulse here, which is not palpable. All right, I'm going to go ahead and listen to your heart sounds. We're going to do that with both the diaphragm and the bell of the stethoscope. The bell helps me to hear if you have any murmurs or bruits going on, abnormal blood flow. So we're going to listen at your 5 major heart valves. So that's your aortic, pulmonic, second pulmonic, tricuspid, and your mitral. All right, I'm going to listen with the bell now. All right, very good. Some heart murmurs are easier to hear when you're lying down, so I'm going to go ahead and get you to lie down for me with your head facing this wall. We're going to listen again with you in that position. Right, so I hear S1 and S2, which are your normal heart sounds. There's no missed beats, no clicks, murmurs, gallops, or rubs, so everything sounds good. While you're lying down, I'm going to go ahead and check all your pulses, okay? And then we'll move on to your stomach. So we're checking your carotids, your brachial, your radial pulses, your femoral pulses. Popliteal. Posterior tibial. And your pedal pulses. All right, all of your pulses are equal on both sides and 2+, so that's good. You go ahead and inspect your abdomen now. I apologize in advance if you're ticklish. This part might be a little bit hard. So, your abdomen looks flat. It's got no peristaltic waves or visible pulsations, which would be a sign that your aorta is malfunctioning. You might have an aneurysm. So I'm going to go ahead and take a peek, and then we will listen in all 4 quadrants. All right, your vowel sounds are normal and active in all 4 quadrants. I'm going to go ahead and listen for some bruits in your abdomen as well. So we're going to listen to your aorta. Alright, so no bruits noted in your aortic, renal, iliac, or femoral arteries, so that's good. I'm going to go ahead and percuss your abdomen like we did with your lungs. And I'm going to percuss the span of your liver. Alright, so the span of your liver is about 6 centimeters, which is normal. I'm going to go ahead and palpate very lightly. Just tell me if you have any tenderness or pain. Feel okay?
Mm-hmm.
Alright, so I'm going to press a little deeper this time. Feel okay?
Mm-hmm.
Alright, so go ahead and take a deep breath for me and let it out. I'm going to feel for your liver right up into your ribcage. The liver is not palpable. I'm going to feel for your spleen. Your spleen is not palpable, which is good. We wouldn't expect to feel it. I'm also going to palpate for your kidneys. I'll have to press a little bit for this one. So. All right. And kidneys are not palpable, so that's good. We wouldn't normally feel them. And finally, I'm going to palpate for your aorta. Your aorta measures approximately 2 centimeters, which is good. We'd expect that. All right, finally, I'm going to check your inguinal lymph nodes, the horizontal and vertical chains. Sorry, I know that's a little hard. And then finally, we're going to do your abdominal reflex. But this will make you ticklish, so I'll go ahead and warn you. There you go. Excellent. So that's intact. All right. While you're lying down, I'm going to go ahead and check your leg function and your hip range of motion. So tell me if you feel any pain or tenderness in your hips. Okay. What about your knees? Okay. Ankles? Excellent. Okay. So just lift this leg up for me. Very good. I'm going to bend it out. Bend it in. Any pain? Good. We're going to do that on the other side. Bend it out. In. All right, any pain, tenderness? Excellent. All right, you can go ahead and sit up for me. Just swing your legs over the side. All right, so we're going to test your upper body strength. Go ahead and raise your arms up for me. And then out to the side, like this. And then shrug out. Good range of motion on your shoulders. We already checked the range of motion on your neck and your hips. So the next thing we're going to do is just feel your arms. Well muscled, even hair distribution. Feel your wrists. Any pain? Good. Go ahead and grip my hands as hard as you can. Excellent. And check your capillary refill. It's less than 3 seconds, so good circulation. Go ahead and squeeze and release your fingers. Do this. Yeah, don't move your elbows, just move your wrist. And then up and then down. Very good. We're going to test your strength. Put your arms up like this. Push against me. And then pull. Very, very good. So strength is 5 out of 5 in both upper extremities. And then for your legs, I want you to go ahead and kick your knees out for me. Very good. Go ahead and press out against resistance. Pull in. Very good. And then with your feet, I want you to push up against my hands. Very good. And then push down like a car pedal. Excellent. Strength 5 out of 5 in your lower extremities as well. We're going to test your sensation. So tell me if you feel a light touch.
Mm-hmm. Yep.
Okay.
Mm-hmm. Mm-hmm. Mm-hmm.
Very good.
Mm-hmm. Mm-hmm.
Okay.
Mm-hmm. Mm-hmm.
Okay, we're going to do a pin break.
Mm-hmm. 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 Good. Mm-hmm. Mm-hmm.
Very good. Now we're going to test your vibration sense. So I'm going to touch this to your skin. Just tell me if you feel the vibration.
Yes. 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 Yes.
Very good.
Yes. 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 Yes.
All right, 2 more vibration tests really quick. I'm going to place this on the top of your head. Tell me if you hear it both sides.
Yes.
Very good. All right. I'm going to take this and place it on your mastoid bone. Tell me when you stop hearing the sound.
No.
And tell me again when you stop hearing it.
No.
Very good. We're doing it on the other side as well.
No. No.
All right, excellent. So that's just checking to make sure that your air conduction is longer than your bone conduction, which would indicate normal hearing, and it does. So next I'm going to test your reflexes. So we're going to do your triceps first. Just relax your arm in my hand. Very good. And do your brachial. All right, and your radial. Okay, I'm going to do the other side. Very good. All right. Then we're going to test your patellar reflexes. So just hold your hands like that. See, you know the drill already. All right. Very good. Very good. All right, you can release your hands. I'm going to test your Achilles reflexes in your heel. All right. And finally, I'm going to check your Babinski reflex. This might tickle a little bit. Very good. I'm just checking to make sure your toes curl inward instead of outward, and they do. All right. So next we're going to do a couple of neurological coordination tests.
Okay.
So if you would, go ahead and flip your hands like this for me. Very good. And do it on the other side. All right. Close your eyes. I'm going to take an object, put it in your hand. I want you to tell me what it is.
A key.
Excellent. So that's testing stereognosis, which is your ability to recognize an object without looking at it. Finally, I'm going to get you to stand up for me. All right. And take the heel of your right foot and then rub it down the shin of your opposite leg. Very good. And then do the same thing on the other side. Excellent. That's testing your coordination as well. I'm going to have you turn around. Check your spine. I'm looking for alignment. Everything does look well aligned. Tell me if you feel any tenderness or pain as I'm palpating your spine.
No.
Feel okay? Good. All right, I'm going to place my hands on your hips. I want you to bend at your waist, bend forward. Don't bump your head on the table. We're just checking for spinal alignment and any sign of scoliosis. And your spine is well aligned, no scoliosis. Then go ahead and lean back towards me, checking your spinal range of motion. Very good. Lean to the right for me, and then to the left. Twist to the right, and then twist to the left. Excellent. The spinal range of motion is intact. All right. And then I'm going to come around to this other side of you. I want you to just walk forward towards the opposite wall a few steps so I can watch your gait. Good. You can stop there. Looks good. Now walk towards me on your tippy toes. Excellent. Okay. Turn the other way and walk heel to toe as if you were doing a sobriety test. Excellent. So we're just checking your coordination. That looks good. All right. The last thing I'm going to have you do is stand right here in front of me. Okay. Put your arms out to your sides. You're checking your balance. Now go ahead and close your eyes. All right. So that's called the Romberg test. It's testing your balance, and your Romberg test is negative, so that's good. Everything looks wonderful. Is there anything else I can do for you, or any questions you have for me today?
I don't think so.
All right. Well, thank you very much. I hope you have a great day.
Thank you.